Let's bring in ABC News medical contributor and board-certified emergency physician, Dr. Darian Sutton. Thank you for joining us, sir. So we're seeing an uptick in cases across the U.S. and in California in particular. Beginning today, a statewide mask mandate has been reimposed in that state. This comes as the Los Angeles Public School District's Board of Education approved delaying enforcement of its COVID-19 vaccine mandate to the fall. So what do you make of this?
You know, there's a lot of variables that are up in the air right now, Kenneth, and trying to understand this virus and its variants as we're seeing an increased rate of cases. And unfortunately, this Omicron variant spreading at a faster rate than we've seen prior variants. When it comes to schools, I have to applaud the LA school district and the entirety of California, as more than 85% of those over the age of 12 have been fully vaccinated. And while I do understand that it is difficult, especially for parents, to make this decision on whether or not they should get their children vaccinated, I just want to focus on some important numbers. Since we have become aware of the Delta variant, for example, we saw a 5-fold increase in the rates of pediatric presentations to the hospital for symptomatic cases of COVID-19. And last week, we saw approximately 23% of the total cases of COVID-19 belonging to children. And that rate has increased over about 4%. And so although these numbers seem small, it is concerning when you look at what's going on in the UK and the rapid spread of Omicron as we're heading into colder and colder months, as we're getting indoors and sharing close contact with each other, increasing risk of transmission. So all of this goal in terms of mass mitigations and vaccine mandates is to prevent the further transmission of this virus and its variants. And when it comes down to it, Kenneth, honestly, it comes down to a capacity to treat. Is our hospital care system able to treat this many patients? And the answer often is no.
And not just coronavirus patients, COVID patients. Obviously, they're going to be people who need emergency medicine services for all kinds of things, and they'd get crowded out. So let's move on to this sense of the vaccine. Dr. Fauci says that the vaccine, many people, that we don't need a new one for Omicron, since the vaccine regime that we have now, 2 shots and a booster, should be effective. And so then I think people might ask, well, why is it spreading so fast? Maybe the vaccines aren't working. Can you help them out with that?
Yeah, so this is also a complicated answer, but I'm going to try to break it down. So right now, we are seeing that the Omicron variant is spreading at a faster rate than prior variants, and that can be due to a couple of different reasons. Number one, when we're looking at the rates of spread of Omicron, these are all samples. And so, of course, we're hopeful that we have a good understanding of what's going on the ground as a total number. We're only getting 1% of the larger picture. And this could be due to the fact that the virus is actually more transmissible, or is it evading the immune response that has been protecting us against COVID-19 and all of its variants after we get vaccinated? And the answer probably is a combination of both. Unfortunately, as time goes on, we will likely see cases increase, but the numbers really do tell when you're looking at not just cases, but hospitalizations, percent of positive tests, and deaths. And when you look at all those variables, we can see that rates of cases are increasing, but luckily hospitalizations are not. And we're hopeful and optimistic that this will continue as more and more get vaccinated, and hopefully this virus doesn't cause more harm.
So, Dr. Sutton, we talk about those high case numbers. So we know case numbers and positivity rates have been the #1 metric public health officials use to make policy since the pandemic started. Terry and I were just discussing moments ago, saying, look, it's a new world, or a different world than it was, more than a year ago when this pandemic started. We have vaccines now, we have boosters. And now that we have those things and other treatments for COVID, are case numbers really the best metric to use anymore?
I think honestly, Kenneth, is that case numbers need to be combined with other metrics to understand the whole picture. And so what we're going to see and start to see more and more is a decoupling of the case numbers and hospitalizations. Prior to the Omicron variant, and even prior to when we had the outlay of vaccines to the general population, we would see kind of a sequential trend. We would see cases, then hospitalizations, then deaths, and they would increase and kind of follow each other. Since the outlay of the vaccines to the adult population in America, and hopefully more around the world, we're starting to see a decoupling. We're starting to see cases increase and kind of bump up in other different places, but we're not seeing that rate of hospitalizations. And so that's what we call that decoupling. Now, of course, that could be to a couple of different reasons. Number one, vaccines are more available, but also this new variant might be less harmful. I think it's more honestly a combination of both. I think when you're trying to answer the question of how concerned should we be, I think you need to take all of these variables into play when you're calculating your risk at the end of the day. And again, that includes case numbers, hospitalizations, deaths, and also percent of positive tests.
And here we are, Doctor. We're 2 years into the pandemic now, and the United Kingdom had its worst day measured by cases ever. 78,000, more than 78,000 more cases of coronavirus recorded in the United Kingdom today. That clearly is something new, a pace, a level of transmissibility they haven't seen before. And yet, you know, in keeping with what you're saying, look at all these factors, they basically lifted the bans, the travel bans they had on countries in Africa and elsewhere. What does that tell you about the UK government's response? That at the beginning they tried to slap all the bans on it, and now it's clear they're living with Omicron, and maybe they don't need them anymore.
I think it's more of a question of what is the benefit of a travel ban. When we first got aware of the Omicron variant by the astute ingenuity of the South African researchers who were sequencing due to their efforts that have been ongoing from the HIV/AIDS epidemic that is still currently ongoing there, they were able to tell the world, hey, this is something that is wrong. You need to be aware of it so that we can catch it. And unfortunately, it seems as though they're very much punished. These punitive restrictions were placed on African countries in which it really wasn't helpful in terms of delaying the spread of this virus. What works is thoughtful evidence-based prevention, and that includes genomic sequencing more, that includes surveillance testing, screening, and of course, vaccine equity. Providing vaccines to these countries and communities in need will help to decrease the transmission of this virus, and unfortunately is still very much a privilege around the world.
And Dr. Sutton, so Terry just was talking about and asking about the effectiveness of these vaccines and, you know, how that, you know, corresponds to what we've seen with these latest numbers here. And the WHO director said there's evolving evidence which suggests a small decline in the effectiveness of vaccines against severe COVID disease and deaths, you know, as well as a decline in preventing mild disease or infection. So what does this mean for us, especially when it's coming from the director of the World Health Organization?
I think that we can expect that whenever we discuss a new variant, we can expect that variants will chip away at that immune response that is protective for us that we've built from vaccines. And when I try to explain that to patients, you can think about your immune system as a home. The front door is guarded by those antibodies that are helping to protect those viral intruders from getting in. As time goes on after your vaccine, those antibodies wane. And so that front door protection may decrease, but you still have this long-term immune response that's living in your home, protecting your home from having the virus set up shop. And that's exactly what's going on. We're having a population that has waning immunity and decreased antibody resistance, and these viral intruders are getting into the home and causing infection. But you have long-term immunity that's been built up over time, and that helps to protect us against having disease progression, hospitalization, and death. And so I think when you're looking at these pictures, you just have to understand a little bit more about how complex, elaborate, and nonspecific the immune response is, and how although these variants will chip away at that response, it does not eliminate it. So they're still providing incredible protection.
All right, Dr. Sutton, there's a lot there, and you helped us break it down. We appreciate it. A big thanks to my smartest friend on social media. Thank you again, Dr. Sutton. We appreciate it.
Thank you.
Always so good.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.